Meet Pat Sturtz, a 75-year-old active retiree who loves spending her days on the golf course. But if you've ever found yourself unable to take part in the activities you love, you may just relate to Pat's story.
You hit a golf ball and I don't care what color it is, you can't see it.
You see, Pat suffers from chronic dry eye syndrome, an irritating eye condition that hinders nearly 1 in 5 Americans. In fact, it was such a struggle for Pat that she often found herself applying eye drops, that's artificial tears, all throughout the day.
I would probably use a box a week.
And when she didn't use eye drops, she was plagued with itchy, scratchy, painful dryness in her eyes.
It's like having grit in your eye.
Dry eye syndrome occurs when the eyes don't produce enough tears, or when those tears don't have the proper chemical balance to lubricate the eye tissue. It's a common problem related to age in patients who have had previous eye surgery or those who use contact lenses. For some, it can become a life-altering burden.
Reading it was so important to me, and I had to stop. I couldn't read, little print. I couldn't read the newspaper. I couldn't read a book.
Most physicians believe that if patients are using eye drops more than 4 times a day, they should consider other options, but until recently, there were none. Not long ago, Pat learned about a new procedure, intense pulsed light therapy, a painless procedure that takes less than 10 minutes to complete in the office. She learned about the procedure from her doctor at Ocala Eye, Peter Pollock.
Intense pulse light therapy, or IPL, is really one of the first new treatments for dry eye in a long time.
Until now, Dr. Pollock says the only way to find relief for dry eye was through eye drop medication. But with this new procedure, a series of simple light bursts reduces inflammation in the eyelids that causes the dry eye. During the procedure, the patient's eyes are protected and they only feel a warm sensation on the face.
It's a 15-minute painless procedure done in the office, and there are no restrictions after the procedure. There's no pain involved. The eyes are covered. The patient will experience an intense light and a feeling of warmth, sort of like stepping outside in very intense sunlight. Most patients that have the procedure will report immediately feeling a sense of relief, and over the next several days, less stinging and burning and tearing.
And on this day, Pat is receiving her 3rd treatment, and she's already experienced a big difference in her vision.
It helped. It's so much better, so much clearer. I am seeing better.
So you can imagine that when patients are using eye drops up to 20 times a day, that has a significant impact on their daily activities, such as golf, driving, television, or movies. And in her case, she had a significant improvement after the procedure and was able to go back to the things that she loves to do.
Clearer vision that leads to a better quality of life. And in Pat's case, it just may save her a few more strokes on the golf course. To learn more about intense pulse light therapy, visit ocalaeye.com/IPL.